bereavement research because I think it's important to establish an evidence base for whatever our practice is. And bereavement happens to be an area which is very suitable for research. It's a major stress which most of us will experience at some time or other in our lives. It's one which we're unlikely to be well prepared for. Compared with other stresses, they take place at a particular place and time, which from the research point of view is a great advantage. If you compare them with other stresses such as child abuse, for instance, it goes on and on for years very often, and it's difficult to identify a particular moment in time. It's unlikely to be one particular stress experience. Other stressors may themselves result from psychiatric problems, in which case it's difficult to know how much to attribute to the stress itself. For instance, separation and divorce, which has been widely studied, often arises in a disturbed family in which psychiatric problems may well already be evident. So it's hard to know exactly how much to blame the separation or the divorce for the events that occur after it. The other great advantage of bereavement studies is the public records, the death certificates and similar records, hospital records, which enable you to identify people who can then study more easily. Most people are relatively naive about bereavement. This raises some ethical problems because very often when you interview someone following bereavement, they'll cry. And the question is, should you discontinue your interview or should you hang in there with them? I've had a lot of experience in this field, and I remember how anxious I was in the early days. I wasn't sure it was ethical at all to do this research with bereaved people. What convinced me that it was ethical was the gratitude of the people who'd shared their thoughts and their feelings and cried and appeared so vulnerable, because the vast majority of them, and the number for whom this was seen as a problem, was very low indeed. The vast majority of people were saying, thank you so much, I needed to talk about that. And the fact that they were able to cry wasn't seen by them, or I say by me, as being a problem. The other thing that people like helping with bereavement research is often the feeling that some good may come out of it. You know, when we go through bad experiences in life, it makes us feel very helpless, and somehow having the opportunity to help someone do some research in the field makes you a little bit less powerless. You're actually bringing something good out of the bad thing that's happened. Having said this, it's obviously important to avoid the danger of exploiting vulnerable people. We need to make it easy for people to say no. We mustn't pressure them to take part in the research. There is no research without service, in a way. I mean, there's a slogan at the Tavistock which was no service without research, no research without service. And I think there's an element of truth in this. You know, throughout psychiatry particularly, we learn from every single patient, don't we? So in a way, each patient is a part of our education, it's a part of research. But equally, I think we owe something to the people who help us. And although there is always a danger of contaminating data when you reach out to people who are there not to receive help but to help you, I think that the benefits outweigh the risks. I find on the whole, if you respond to bereaved people in a helpful sort of a way, you'll find the data is much more valuable, you'll get more honest responses from them than if you just treat them like a blank screen, if you ask a series of questions without actually allowing them to elaborate answers, for instance.